Hey guys, right now we're going to discuss question number 14, which will be your frontal bone and parietal bone. Let's see if we find parietal bone, which is right here. First off, we're going to begin with the frontal bone. Once again, you guys have to know that the frontal bone has a external surface and internal surface, a nasal part, an orbital part, okay, which is right here. And now we're going to look at the frontal bone from an external view, okay. Now looking at the frontal bone, superiorly you're going to have your parietal margin, which is where the coronal suture will join the parietal and frontal bones together. Then you have something lateral to the frontal bone. You see this line right here, which is labeled as 13. That's going to be your continuation of your temporal lines from the parietal bone onto the frontal bone. Okay. Now, in the midline, you're going to have your frontal suture, or in newborns, it's going to be known as the metopoic or metopic suture. And you're going to have eminences on each side of the frontal bone, which are going to be known as the frontal eminence. And you have your frontal plane and your squama of the frontal bone. Okay? Now, we're going to look at the supraorbital margin, which is this area right here. Okay? Now, your supraorbital margin, above that region is going to be your superciliary arches, which is number 5. And in between your superciliary arches, or the area between the eyebrows, number 6 is going to be your glabella. Okay? And as you can see, the frontal sinuses are labeled right here. Okay? Number 29, you're going to have them kind of right above the glabella on each side. And now we're going to look at the supraorbital margin more in detail. Okay, now right here you have your orbital part of the frontal bone, and you're going to have your supraorbital margin. Now, if you look at number 9, that's going to be your supraorbital notch, but the supraorbital notch joined with connective tissue will form the supraorbital foramen. And now, medial to that, you have something labeled as 10. That's going to be your frontal notch, okay? Now, the supraorbital foramen is going to be used for the passage of your supraorbital nerve and your supraorbital artery, okay? Whereas 10 is going to be your passage for the supratrochlear artery, okay? Now, medial to that, number 25, it's very important, is going to be your trochlear fovea. Now, your trochlear fovea is something which the obliquus superior goes into, and then basically the obliquus superior muscle, which is an eye muscle, goes through that and then inserts superiorly under the superior rectus of the eyeball. Okay, and the superior rectus is also another eye muscle. Okay. Let's see, is there anything else? I don't believe so. Now going back, number 14, you have your zygomatic process of the frontal bone. And now that we discussed the external and the orbital part of the frontal bone, let's look at the internal surface. So once again, you have your orbital part right here of the frontal bone, which is the roof of the orbit, and also lodges the frontal lobes of the brain. You have your groove for the superior sagittal sinus, which is labeled as number 17, okay? And this groove is going to run into number 16, which is going to be your frontal crest. And your frontal crest is actually going to lead into the foramen cecum. It is important to note that the frontal crest is going to serve as attachment for the falx cerebri of the dura mater. And the frontal crest of the frontal bone is going to insert onto the ala of the crista galli of the ethmoid bone. Now the ala of the crista galli, as I've just said, is going to be used for the attachment of the frontal crest of the frontal bone. But the crista galli itself is also going to be another attachment for the falx cerebri of the dura mater. Okay, and then that basically sums up your internal surface of the frontal bone. Let's look at the nasal part of the frontal bone. Basically, you have your nasal part, which is number 19. You have your nasal margin, and you have your nasal spine, which is the sharpest point of the nasal part of the frontal bone. Okay, and in between the orbits, you have something called the ethmoidal notch. Okay, just a area between the right and left orbit. Now let's discuss the parietal bone. Okay, now let's look at an external view first off. Now the parietal bone is quite simple. Okay, you just mainly have your borders. You have your anterior border for the frontal bone, which will be your coronal suture. Okay, border for the coronal suture, which will attach the frontal and the parietal bones together. You have your superior sagittal border, which will be where the superior sagittal suture attaches the parietal bones together. Then you have your inferior border, which is going to be your squamous border, which will be the attachment of the squamous suture that will attach the parietal and the temporal bones together. And then last but not least, you're going to have your lambdoidal suture, which is going to attach the parietal and the occipital bones together. Now, above these two lines, you're going to have something known as the parietal eminence. Okay, this is a depression protruding laterally. And then beneath that, you're going to have your superior temporal line, number 31, and your inferior temporal line. Now, inserting or attaching to the temporal lines, you're going to have your temporalis fascia, but originating from the superior temporal line, you're going to have your temporalis muscle. Okay, that's pretty much it. Oh wait, and you have number 42, which is going to be your parietal foramen, which will be the passage for mesenteric veins. Okay, now let's look at the internal surface. On the internal surface, you're going to have this thin white line, which will be the groove for the superior sagittal sinus. Then you're going to have a little depression right here on the postero-inferior border of the parietal bone, which will be the groove for the sigmoid sinus. And then you're going to have these little indentations of branch-like areas. That will be your sulci for the middle meningeal artery, which is the largest supply to the dura mater. And that, my friends, is the parietal and frontal bone, and that should cover question number 14 of the section A syllabus.